Well, welcome to today's talk, Friday the 4th of March. Now, the headline says that 140 million Americans have been exposed to the SARS coronavirus 2. I read that and I thought, is that all? So we're going to have a look at that in a minute. But first of all, let's look at some orientation. So here we see some really pretty interesting graphics. So this is Denmark coming down. Now, of course, at the beginning of February, Denmark abolished all of its all of its legal COVID restrictions, so it's about there. Then cases went up somewhat for a relatively short period of time, and since then they've been going down. So does seem to be vindication of the Danish decision, actually, from that graphic anyway. We'll come back to New Zealand in a minute. Netherlands, again, Omicron wave going down, slight uptick there. I don't think that's probably going too far, but way down here we have Australia, Ireland, the United Kingdom, Japan, United States, Canada, India with much reduced rates. Now, going on to New Zealand here, New Zealand, Omicron is spreading around New Zealand rapidly, and that will continue to increase as long as they are testing adequately to collect this data. So the areas that are catching up now are New Zealand, and as we'll see in a minute, Western Australia, which tried to close things down but couldn't. And we'll see another example of somewhere that tried to close things down in a minute as well. Omicron, obviously, everywhere. New Zealand has still got a little bit of Delta, but basically we see Omicron has taken over, displaced Delta, which is fortunate because in a vaccinated population, that's associated with less hospitalisations and deaths. Now, just to emphasise that, number of COVID-19 patients in hospital per million. Now, Denmark has gone up, but we did look at studies that showed that the majority of these were incidental findings, just because there's so much Omicron, SARS coronavirus 2 infection all over the place in Denmark at the moment. So I'm happy that's going to go down fairly soon. Hospitalisations going down in the United Kingdom, Canada, Ireland, yes, slight downward trend. Netherlands and Australia still relatively low. So that's hospitalisations. New data confirmed deaths per million. Well, again, a lot of these deaths in Denmark are incidental. They're not all by any means caused by the virus, just because there's such a high prevalence over a short period of time. United States deaths are going down, but we are going to reach 1 million deaths in the States. It's really quite well, it's 1 million deaths, isn't it? What can you say? United States, United Kingdom. Let's try and get in that trend a little bit there. Yeah, that's the UK line there. So that the deaths are going down in the United Kingdom. Ireland, they've come down dramatically, levelling off somewhat. Australia, probably stay levelish in Australia for the time being, because there's pros and cons there. I'll show you those in a minute. Canada, Netherlands, New Zealand, India. New Zealand, unfortunately there will be some deaths in New Zealand as the virus spreads around dramatically, but I'm hoping they're going to be really minimal because of the highly vaccinated population. Now, this next slide is quite incredible. Hong Kong, of course, has been as far as I know, is still maintaining this ludicrous, completely impracticable zero COVID policy. And let's have a look at the result of that. So they're doing everything to isolate the virus, 100% all out, human beings attacking the virus, 100%, this is what they got. There you go. They're the cases in Hong Kong. I mean, you know, we said a while back that Omicron, you can't really stop Omicron, and I think Hong Kong have demonstrated what we said really quite clearly. That is the cases in Hong Kong, and I've left in the comparators of the United Kingdom and the United States. So despite their best efforts, they have not contained Omicron. As we said, this is exactly what we said. Well, why don't all the brilliant people in Hong Kong realise this? Well, maybe they do, maybe it's outside influences. But whatever, it's ludicrous, and this graph proves that, just ludicrous policy. Now, this is intensive care admissions in the United States they've come down, in the United Kingdom they've gone down. Very nice dramatic drop in the United States. But the reason I put this slide on was there's no hospital data for Hong Kong and no intensive care data. But we have seen these really quite distressing people piled up on trolleys, or rows of trolleys, outside hospitals in Hong Kong as lots of people become sick all at the same time. Not good at all in Hong Kong because the population is not that well vaccinated. So they're the deaths in Hong Kong. So this is the effect of the zero COVID policy on the deaths in Hong Kong. Absolutely, well, it's as high as the United Kingdom was at its peak up there. So horrendous rise in deaths in Hong Kong. And we look at the vaccination. So these are people who've had two vaccine doses, and on the face of it, there it looks fairly similar, with a sudden, you could say, panic increase in Hong Kong. But the thing in Hong Kong is the demographic uptake of the vaccine is that there's a very large proportion of older people who have not taken up the vaccine. And of course, the combination of being unvaccinated, unexposed to a natural virus, basically people are naive, having no immunity at all. Omicron comes along, even though it's 25, 33% or so less pathogenic than the Delta variant, and that still results in an awful lot of deaths. So even though the vaccination rates look fairly high, because many older people are not fully vaccinated, then it's having a very high death toll in the older people in Hong Kong. Now, a lot of people have made a bit of a fuss about this. The booster dose in Hong Kong is also pretty low. But I think the main factor in Hong Kong, okay, the booster dose is a factor because we know a booster dose does protect from severe illness and deaths. But I really think the main factor in Hong Kong is the fact that a lot of the older demographic have not had the vaccine at all. They're completely naive to the virus. Combine that with this ludicrous zero COVID policy, and they're the graphs that we got.